Great. I think we can slowly get started with our side event today for the UN 2.0 week. Welcome, everyone. We're hosting a session from FAO at this forum today. And for the UN Behavioral Science, for the UN 2.0 week, the Behavioral Science Day today is focusing on applied application of behavioral science within FAO. And we have three amazing speakers with us today that are going to tell you a bit more about their research in specific areas applying the behavioral science methodologies. Later, we will do a panel discussion with all three of the speakers, and you will also get the chance to ask your questions to the speakers live today, and then we're closing. And all this will take about an hour. So we will start with a presentation of Annika Bouquet. We're very much looking forward to hearing about how you applied behavioral science to AMR resistance and also how you further integrated this into the One Health priority research agenda. So yeah, looking forward, Annika Bouquet, to hearing your presentation. Over to you.
Thank you very much, Julia. Just this. Is it all right? Can you see my screen?
Yes.
Okay, thank you, Julia. Yeah, in the next 10 minutes, I will introduce very shortly what AMR is, why it is important to address AMR in animal health, and why it is important to do so by using social and behavioral science approaches. Before we start, AMR stands for antimicrobial resistance. And antimicrobial resistance is considered to be one of the most urgent and one of the most complex global public health challenges, and one that stands to jeopardize almost all of the Sustainable Development Goals. AMR is when microorganisms like bacteria, viruses, fungi, parasites evolve to become resistant to drugs that originally were designed to kill them. So you probably have heard it in the context of antibiotic resistance or the superbugs in hospitals, which essentially just describes that our antibiotics don't work anymore to address infectious diseases. And a big problem with AMR is that AMR develops much, much quicker than we are able to develop new treatments. And while AMR is something that would happen quite naturally through self-selection and natural evolutionary processes, it is accelerated by human behaviors. Human behaviors are actually considered to be the most important driver and accelerator of AMR. Any kind of use, but especially the overuse and misuse in human health, animal health, and plants. And if you don't address AMR, infections become quite harder to treat. Some of them will be impossible to treat. So this is a threat to human health, but also to animal health and animal well-being, and as a consequence also to food security and modern medicine. So now, even though it's widely recognized that human behavior is the largest driver and accelerator of AMR, social and behavioral science approaches remain largely underrepresented and unacknowledged when we talk about AMR solutions. And this is especially true in the context of animal health. It's often considered a biomedical problem, and in some ways it makes sense because AMR is about microbials developing resistances, it's on a genetic level, and it happens in the public health context. So the research around it is in biomedical sciences. And a consequence of that is that the solution that we think around is also considered, should be a biomedical solution. The way behavioral science is acknowledged is through the language of behavior change. But often this is a very narrow view. So in research, it's often, we see it through CAP studies, that's short for knowledge, attitude, practice studies, especially in the animal health sciences. to understand the factors influencing behavior change. But now the idea around knowledge, attitude, and practice is that it surveys, and it essentially looks into the state of knowledge, the state of attitudes, the beliefs people hold, and how that influences practices. So you can already see there's kind of a narrow view and the belief that it's knowledge and attitudes influencing practices. You find a lot of behavior change languages also in policy documents like national action plans, but it's nested within the awareness pillar, basically the awareness strategies or educational and training strategies. This is where the behavior change language comes up. And this is quite a narrow view on behavior change and the factors influencing behavior change and the social and behavioral sciences in larger terms. And this is also despite the evidence. There's a large body of evidence showing the contrary. And this is just from the animal health sciences. Some of them are human health studies, all based on CAP studies showing that knowledge and attitudes don't really influence behaviors all that much. There's really no straightforward correlation. There's only very weak or no existing correlations. And to this end, we have published, led by the University of Essex and the University of Vienna, together with colleagues from WHO, a paper on, it's a comment on that we need to use more social and behavioral sciences in AMR research. The way FAO is approaching this is through roughly 4 steps. Those that are familiar with behavioral science have seen a version of that in one way or another. We start in our implementation of behavior change approaches often by understanding the factors influencing behaviors through formative research. This is theory-driven, and then using the evidence generated through those formative research activities by co-designing solutions. Those 4 steps are a version of this co-published paper with WHO colleagues. So if you're interested to learn more about this, you can read this publication. And what it means for FAO specifically, or for FAO in animal health to address AMR, is first that we use a theory-driven approach in our formative research. That means we use established methods and models from the behavioral sciences. That could be the theoretical domains framework, the behavior change wheel. It could be psychometric approaches. I think also the latter will talk more about it later on. But our research is informed by already established methods and models. On the right side, you can see different research projects we have. In the middle one, you see a research project we did in Nepal, and usually we also publish on it. For instance, this is the first ever publication using behavioral science approaches or methods in FAO and AMR. Then second, we then use this evidence to co-design interventions, behavior change interventions, often using also frameworks that offer a list of behavioral insights like the EASE framework you can see on the right side. And this is what we then call evidence-based. And then lastly, one of the mandates FAO has, of course, is also capacity building, and to build a capacity around of extension workers, animal health extension workers in communities, to use models from the behavioral sciences to understand the factors influencing practices in their communities, to understand barriers and enablers. So here on the right side, for instance, you can see that the facilitator is using the COMB model of behavior change to understand record keeping of his farming community. And here are 2 examples of interventions designed by farmers themselves. They were using the EASE framework to make food bath use. This is a disease prevention approach, easier and attractive. So on the left side, you have a bottle measurement tool where they're trying to make it easier for them to use disinfectant and to arrive at the right dilution rate. On the right side, you have a poster reminder using loss aversion. not using AMR language at all. They talk about profit here to make it more attractive, and using pictures instead of just a plain text saying, use the foot bath. On a more strategic level, going from fieldwork now to policy, another major issue with AMR is that resistant pathogens can spread between humans, animals, plants, and the environment. So it requires a One Health approach. So FAO has joined with UNEP, WHO, and WOHA, and it's called a quadripartite to address AMR from a One Health approach. In the way they have acknowledged bioscience was through the One Health priority research agenda for AMR, which generally outlines and identifies key knowledge gaps that still remain and priority areas for research. And one of the 5 pillars identified is behavioral insights and change. So on the right side in the document, you can find the 4 areas and more specific research questions. Then lastly, this was a major milestone for us, was during the last UN General Assembly, where we formulated a new political declaration on AMR. And that also marked the formal commitment of the member states to now address AMR through various means, but also for the first time through integrating social behavioral science approaches. So this language now appears more direct in high-level strategy policy documents and gives us a direct mandate. And FAO internally, we have a 10-year AMR strategy called Reduce the Need for Antimicrobials on Farms for Sustainable Agri-Food System Transformation, in short, RENOFARM. And it's basically our strategic framework for the next 10 years. And social behavioral science is a strategic pillar to support the core mechanisms to achieve RENOFARM outcomes. So it's also formally now integrated in FAO's own strategic approach. And with that, coming to an end, RENOFARM also has a mandate to build capacity and raise awareness around integrating more social and behavioral science to address AMR, particularly in animal health. And to this end, we have designed a MOOC that's a online learning. And we are going online end of this month for 4 weeks. And I would be very, very, very happy if you want to join, if you want to learn more about our work, but also if you want to learn more about behavioral science and how you can apply it to address AMR in agri-food systems. There's a little QR code that you can scan. It's, of course, for free. It will include tasks. You have facilitators, including me, helping you with understanding behavioral science. You can ask questions. You are supported throughout the full 4 weeks. And I think also Julia is going to post a registration link in the chat. So I would be very happy to see you there. Thank you very much. Yeah, contact details. And I think I hand over to Julia. Thank you.
Great, Annika. What an inspiring presentation for the day today for behavioral science during UN 2.0. Super interesting research on how we can advance beyond the usual CAP studies to something very much integrated in innovative approaches, field-based, that then leads to a policy change. Great work. And I think with that, I will hand over to Diletta, who's also going to talk a little bit to the topic of AMR. Or Mo, do you want to go first? That's also a good idea. If you already no, let's stick to the letter because I think the topics are a bit interconnected.
Yeah, thank you, Julia.
Okay.
So first of all, sorry for my nasal voice. I'm a bit sick, so I will do my best not to make it so nasal, but this is the situation. So after the brilliant introduction of Annika about what is the power of behavioral science and what we can do with it, I will now jump into some evidence that we collected through some field experiments where we actually used behavioral science to answer to some research questions. Let me start with with this. So first of all, our main topic was to address antimicrobial resistance, which is a growing global concern, particularly in low and middle income countries. And this was already introduced by Annika. Specifically, in many low and middle income countries, antibiotics are widely used in food production, often without proper regulation. Consumer behavior here can be fundamental by playing a key role in reducing IMR risk through what we call market-based incentives, which were the main topic we tried to address during our experiments. Specifically, this study investigates willingness to pay for antimicrobial stewardship in food production. That is basically the maximum amount of money consumers are willing to spend while purchasing food produced with antimicrobial stewardship. The country we ran these field experiments were Tanzania and Colombia. We replicated the same experiments by adapting the experimental setup, as I will show you in a few minutes, in these two low and middle income countries. The study methodology. First of all, we worked with revealed preferences. Indeed, here the topic is how can we measure the willingness to pay of consumers? That is, how can we be sure about what's the maximum every consumer is willing to pay for a specific product? We use here the concept of revealed preferences. Generally, there are two options in this kind of studies. Stated preferences, which are the preferences directly stated by consumers, and revealed preferences, which are instead preferences that we can understand by looking at the behaviors of consumers. As you can imagine, revealed preferences is quite a cleaner measure, as it's actually a real preferences that we can observe through actions. While normally with stated preferences, there may be some biases, as consumers may understand what is the right choice and may produce some answers, can state some preferences which are not really coherent with what they would like to do in reality. The products we used for this kind of experiments were a function of the country-specific habits and country-specific markets, as you can imagine. Specifically, in Tanzania, we used tomatoes, eggs, and chickens. Sorry, there was a missing element. While instead in Colombia, we used chicken and eggs. As you can imagine, every country have some specific market. That's why also the quantity, so the quantity of the products to be advertised or to be sold were deeply studied through a country analysis, which was done ex ante, both for Tanzania and Colombia. So basically, we replicated a market experiments. We found participants all around the cities by randomizing the neighborhoods where we selected participants so that we could randomize also the income of participants. And then we assigned participants to different treatments. That is the no information treatment, where basically consumers made their purchasing decisions without any additional information on the topic of antimicrobial resistance. And then the information treatment, where instead there was an IMR related food safety information before the purchasing decisions of consumers. Bids, that is basically the revealed preferences to measure willingness to pay, were collected pre and post treatments to assess the impact of such information provision, where the question was, is it useful to inform consumers about the risk behind IMR to influence their purchasing behavior, or their purchasing behavior is just independent from the amount of information they receive? What we found? So basically we found that there exists an organic premium. So on average, consumers' willingness to pay is higher for organic products, that is, for products produced with antimicrobial stewardship, no matter the amount of information they receive. Then, when we want to measure what is the impact of the amount of information they receive, we found that the information treatment changed the range of bids for both organic and conventional products. That is, once they are informed about the risks of IMR, the willingness to pay for organic food raised, because of course they are now even more aware of of what are the risks of not purchasing organic food. Vice versa, after the information treatment, the willingness to pay for conventional product decreased, because now they are willing to pay less, a lower amount for food produced without antimicrobial stewardship. What are here the general takeaways? First of all, information provision significantly influence purchasing behavior, and this is the main take-home that we got from this experiment, as the information really made a difference. So once informed, the consumers of low and middle-income countries made a more conscious decision. Furthermore, evidence suggests that market-driven incentives can complement policy efforts to reduce IMR. Indeed, we notice that once informed, people are willing to pay a premium, so an extra amount of money, to purchase food produced with IMR stewardship. And this actually means that there is a market for this kind of organic food, which should be carefully analyzed and by producers, because actually when producing with antimicrobial stewardship, there are consumers which are willing to spend an extra amount of money to purchase this kind of products. Concluding with some policy consideration and recommendation here, when analyzing market-based approaches, willingness to pay results suggest that consumers' demand can incentivize producers to adopt safer agricultural practices. Regarding certification programs, IMR-free labeling can help under this scenario in building consumer trust and enhance food safety standards in low and middle-income countries. Let me also mention here public awareness campaigns, as the information treatment was strongly significant. So this was showing that strengthening IMR education can lead to greater demand for safer food. Finally, regulatory support is a fundamental key, as policies should complement these market incentives by enforcing IMR reduction measures. Let me just spoiler you, our future research is, our idea is to expand these studies to other low and middle income countries to inform for scalable intervention, as well as exploring the production side to see whether this market for food raised with antimicrobial stewardship can actually be built in such low and middle income countries. With this, I conclude, and thank you. In case you have any questions or you would like to work on behavioral science regarding food safety, feel free to contact me. Thanks a lot.
Great. Thanks a lot, Diletta, for another amazing presentation on AMR. This time, I think working with economic incentives, especially in low and middle income context, is super interesting if you want to increase a behavior change intervention. Now we're going to a bit of a different topic altogether. I hand it over to Mohamed Naeem, who will present on agripreneurship training with the psychological component. Mohamed, over to you.
Thank you, Julia. And thank you, colleagues, who presented. I want to start by talking about the development issue that underlines our work, to give you a background of why we do the work we do. This is a chart of extreme poverty in Africa in the past, let's say, 20 years. And if you can see here, around the year 2000, Africa contributed around 20% approximately to the world's extreme poor. today, or since 2019, is around 60%. And we know extreme poverty affects youth the most, and also women. But it's not all bad news. In fact, Africa has the highest number of entrepreneurs in the world. This is a sort of a mixed news, because this is due to the how rare formal jobs are. So if you are in the labor market and you can't find work, you create your own job. So 1 in 3 Africans, adult Africans, either runs a business or is trying to start a business. It's extremely high percentage. In the US, for example, it's 1 in 7, and Germany is 1 in 20. We also know that Africa has the highest percentage of women entrepreneurs. And we know also that the African agriculture sector is the highest growing sector in the world. So we have this opportunity where agripreneurship can turn a lot of job seekers in Africa who struggle with extreme poverty into job creators and create prosperity. So what is the issue? Africa imports around $46 billion worth of food. A big chunk of it is processed food. So this is an unmet market that a lot of SMEs are not tackling it. But if you dig deeper into the problem of why aren't SMEs working in the agriculture sector taking advantage of this huge unmet market demand, 3 big problems come into light: either access to finance, access to market, or access to capacity building. And as a technical agency, we see the problem from a capacity point of view, simply because if you're an agripreneur in the market and you don't have the right mentality or the right knowledge or skills to manage your finance, it's very, very hard to access finance. It's the same thing with markets. And I want to just quickly touch on this meta-analysis that was done by David McKinsey and others. They followed $1 billion worth of entrepreneurship training a year. So the developing world invests at least $1 billion a year on entrepreneurship, which is a considerable investment. But unfortunately, the return on that investment does not compensate for the $1 billion. And one of the issues is transfer of knowledge. One of the most popular training programs targets 20 to 30 business practices per training, but entrepreneurs end up implementing only 1 or 2 of these skills. Agripreneurship is also a set of behaviors, and successful agripreneurs exhibit certain behaviors. And in business psychology, they call it personal initiative. So how can you become more self-starting, future thinking, and persevere through challenges? And this is a big contrast to traditional business training, where it teaches you things about marketing, finance, record keeping. And so this approach was developed by Lifan University, a professor called Michael Fraser. And the World Bank has tested this approach throughout the developing world. This is one RCT where it was done in Togo in 2017. They gave 500 women, micro entrepreneurs, this psychological training that teaches you, that aims to change mainly your behavior, makes you more proactive, more self-starting, more future thinking, and persevere through challenges. They gave another sample of 500 women micro entrepreneurs their IFC traditional business edge training, and they had a control group of 500 entrepreneurs. So after 2 years, those who received the psychological-based training to change their behavior outperformed those who received traditional business training. The result was 30% compared to 11%. And actually 7 years, they have done another survey, and the results hold after 7 years from the training. So we designed an agripreneurship training that is based on this personal initiative. And we tested the impact of the training on entrepreneurship, self-efficacy, planning, business practices, entrepreneurship action. We had a sample size of around 620 youth agripreneurs. And you can see the ones in green are the weighted control group, and the one in red are the training group. And those who received the training did much better than the weighted control group. We only tested the short-term impact of the training. The training is available online for free at the FAO e-learning academy, and we will share with you a link to the training where you can register and go through it. We'll also share with you the launch webinar for the training, where we did it with the Fine University and MIT bootcamps, who have been instrumental in designing of the training. We also share with you technical brief about the evaluation if you want to look at more information. What are we doing after the online training? We are in the third iteration of the face-to-face training, and we're doing a pilot this year, Ethiopia, Kenya, and maybe South Africa. So the process starts with diagnostics, understanding the ecosystem, where are the challenges and opportunities for agripreneur, value chain selection, understanding where are the value chains that has the highest market potential, highest impact on nutritional deficiencies, and highest impact on environmental sustainability. And then understanding who are the actors in the ecosystem. Afterwards, we do capacity building, where we contextualize the training material to the local context. We build capacity of trainers, and we supervise incubation. And the third step is matchmaking with financial institutions, and then taking advantage or using what we have learned from the evaluations to try to improve the ecosystem again. Thank you very much. If you have any questions, please don't hesitate to contact. Back to you, Julia.
Great. Thank you so much, Mohamed, with concluding our three presentations for today. From the speaker engagement, super inspiring as well, how just adding a psychological component to the entrepreneurship training really seemed to have made a difference, especially in the communities in which it was tested through the World Bank study. Super interesting research. Thank you for sharing that. Colleagues, feel free to use the chat function to ask any sort of questions. We will now do a panel discussion with all three speakers, but we would also like to open this up for your questions after you've heard the presentations. By applying behavioral science to these critical challenges that we've heard, antimicrobial resistance, food safety, and rural entrepreneurship, it all aligns with FAO's commitments to really improve the state of the art through the also quintet of change that we are promoting with the UN 2.0 week today. And given the context of the quintet of change, as well as UN 2.0 and the innovation in your three approaches that you have just presented to us, what parts of your research were particularly innovative and new to the field of behavioral science? You all are, so to say, entrepreneurs or innovators in your fields as well, and we'd be curious to hear more of where did you try something new and add it to the field of behavioral science?
I mean, I can start. I don't know if you want to call names of.
Yeah, Annika, that would be great. Go for it.
I think I wouldn't dare to say that I innovated behavioral science as such. I think we on my team, we don't do this kind of groundbreaking methodological research. And I actually also think that one of the advantages of behavioral science is that there are already established frameworks, peer-reviewed models and theories. So we like to use those, and this might also be based on my background in psychology, where this is maybe more standard. But what I would maybe think is that we use behavioral science to innovate approaches, at least in animal health research, social science approaches. For instance, when I think of the knowledge attitude practice studies, and this is research that Diletta and I did together in Nepal, where we, in addition to the CAP elements, which is we have a knowledge scale, we have an attitude scale, and we learn all about the knowledge levels and attitudes farmers hold. We also integrated behavioral economics measures, risk aversion, and time discounting. And we also integrated a psychometric measurement of psychological financial scarcity. And that's just to say that and I think this is quite innovative, and I have not seen it, at least published so far, that to combine methods across disciplines. We have yet really to dig into the data and publish. But I was really excited about this approach, and I think this is maybe where the innovation is in our research. Thank you.
Great, Annika. Diletta, do you want to respond to
Yes,
that as well?
let me jump in because Annika already introduced some topics that I think are our contribution to your question. So basically here, let me make the example coming from the paper that actually the field experiments that are now becoming a paper, which is still not published yet. That's why I didn't share it, but will be published soon. Yeah, basically the innovation here was that we could really combine several approaches. So, for example, we implemented, let me call it a kind of economic analysis, but at the same time, we started from the behavior. That is, we designed a field experiments to study the behavior of people through their revealed preferences, and then to arrive to some economic conclusions about the willingness to pay, for example. And this is innovative because at the same time we are using some behavioral approaches, for example, through the willingness to pay elicitation or through the revealed preferences elicitation, which could explain us which were the main drivers of consumer choices. So that's why I think rather than simply asking them these questions and getting some evidence from their reply, so we could really see, observe, and measure which were their drivers. And I think that this is the main innovation of our behavioral science approaches.
Yes, I would agree. I think if the papers are not even published yet, it seems to be very new and novel research also to the field. So super eager to hear more from you in the future, and we'll keep an eye out on the publication that you've referenced. Mo, is there anything you want to add on your side as well, coming more from the agripreneurship side?
Yes. One thing that surprised me the most was that the women who received the psychological based training, they had more access to finance than those who received the IFC World Bank finance training. And it's quite shocking that you tell people if you change people behavior, it's much more impactful than if you give them traditional training. And I think it makes a lot of sense. You give people agency so they go find solutions. Capacity is always going to be limited, regardless of how much you invest in it. So it's better to give people the tools so that they find a solution for themselves. And the two most important behaviors that I didn't highlight here, aside from self-starting, future thinking, and perseverance, are things like self-efficacy, which is how much agency do you have, and error mastery orientation, which is how well you deal with errors and mistakes.
Yeah, that's different from the traditional approaches that an entrepreneur would usually take, as you said, with marketing and financing, just getting the tools, but also thinking about her personality affects maybe the way you're running and implementing your business ideas. Very much can make a difference. So interesting research. Maybe talking a bit more towards the theme of behavioral science, which is the theme of today for the UN 2.0 week. For those of you also that have joined, maybe to find out more about the methodological approaches, I could see that there was one question from a student in the chat that maybe I'll hand over the mic to you after this. But what methodological approaches did you find most effective in capturing the behavioral drivers in your research? And how did you adapt these methods to the agri-food system and food safety context or the AMR context that you've referred to? We've heard a little bit from Annika on East and Combi, but also curious to see how you then adopted it to fit the context.
I can start if you want, Julia.
Yeah, it sounds good.
So here, I would like to cite another field experiment that Annika already cited. So the one we conducted in Nepal, where basically I can mention one specific adaptation of a typical behavioral science approach to our specific context. Here, the idea was we were studying producers' decisions, okay, and whether they were following some kind of stewardship or whether they were abusing antibiotics. So here the idea was to see whether their abuse or their misuse was anyhow linked to their risk aversion. That is the fact that they are scared about losing some profits if they were reducing the amount of antibiotics they were used to use. So here, of course, normally risk aversion elicitation comes with a lottery where basically you ask to the specific participants to the field experiment whether you prefer a safer with a lower expected value option or a riskier with a higher expected value option. That is basically the typical lottery choice. But of course, this lottery is a list of decisions. This is normally used in this kind of context, but of course this was supposed to be a little bit complex for an average producer in Nepal, which probably never used a multiple choice lottery. That's why we translated this into the so-called bomb method, let's say. So we basically presented them 10 food boxes, and we told them that they could choose how many boxes they wanted to bring home. They were just free meals they could bring home. So we asked them which was the number they wanted out of this maximum 10 boxes. Anyhow, we told them that one box was poisoned. Therefore, the higher the amount of boxes they choose, the higher the probability of getting the poisoned box. Of course, they didn't know which was the poisoned one. And here, basically, the literature wants that if they choose 5, so exactly the half of the total amount of boxes, they were risk neutral. If they choose above 5, so a number greater than 5, they were risk seeking, and a number below 5, they were risk averse. So this was our adaptation of a risk aversion elicitation in our specific food safety context.
Annika, I see you might want to add something to it, or should we?
Yeah, I can.
Yeah.
I can. I think in terms of methods, so I think behavioral science is often discussed in terms of quantitative approaches, right? How can we use trigonometrics or quantitative approaches to measure cognitive biases, heuristics? And the behavioral science, how it's often discussed, comes from the tradition of psychology, social psychology, behavioral economics. And me, myself, I'm also educated in quantitative approaches. And over the years, I have realized that actually qualitative methods give me the richest insights. Very much against the tradition of our own field. And I think there is maybe a growing recognition toward this. But, and this, I think, is maybe one main reason is that we have done so little research in the context. Psychologists, social scientists, and not social scientists, but psychologists particularly have done very little research in their fields in different cultural contexts. So I'm not that comfortable anymore just going into a context that there is no contextual research. We have no idea what influencing factors are, and coming with a predefined quantitative measurement, because the risk to overlook something is quite big and to create misunderstandings, misconceptions. So the way we are approaching it is now having a really heavy focus on qualitative methods. Also in my team, we also work with an anthropologist. So we use a lot of methods from the social sciences, not necessarily only behavioral science. And if we use quantitative approaches, and we did the same in Nepal, this is accompanied by pilot studies where we contextualize everything we're doing, where we have cognitive interviews to understand how participants understand the questions. And if it makes sense in a cultural context to begin with, because actually a lot of questions, especially individual focused questions, right, maybe don't make sense in other cultural contexts, emotions, these kind of things. So I have become a really big supporter of utilizing more qualitative approaches in behavioral science. Thank you.
Thank you, Annika and Diletta. Super rich insights that you're sharing. Katharina Shiran from Melbourne. I think, yeah, as your background is in applied psychology and you had a question regarding the methodology. If this hasn't answered your question, feel free to unmute yourself and maybe come forward. I know it's quite late in Australia, but yeah, maybe if you're still awake and want to present your question in the forum, come forward, please. If not, I can also read it out.
Hello. Sorry, can you see me?
Yes, and hear you too.
Hi. Thank you so much for the presentation. No, it really did the way that you guys have explained it very much so explained to me a lot about the way that you measured the, I guess, preferences and whatnot surrounding how consumers were approaching the AMR related consumer behavior, I would say. I guess I'm really interested to know, and I think it was touched upon, but the way that in terms of it being framed, if there was a way that, like, I guess we spoke about risk aversion, but the specific way that it was actually framed to I guess, deliver the information of the risks, if there were, I'm just more interested about in terms of that.
Great, Catherine. Maybe if I understood your question correctly, it was on risk communication and maybe gain and loss frame messages, and if the two research tested that. Okay. Yeah, I think they did, as far as I know, their research, but maybe one of you can take the question.
If you want, I can start. I'm not sure if Catherine, you are referring to my second example, the one in Nepal, where I was saying about the bomb method, or you come back to the presentation. So you are referring to the risk aversion elicitation or perception of risk in behind the general context of IMR?
I think within the actual study. So what was the information that was provided to the participants to
to explain the IMR, the problem of IMR. Okay, so this was a fundamental part of the experiment, and actually probably the most difficult, because of course here you need to be sure that you are delivering the right amount of information, and this is comprehensible. So for Tanzania, we used we recorded a video in Swahili, which was the most effective way of delivering this kind of information, because an information sheet was not enough. So we produced this kind of video, and once we showed it, actually people were starting acting differently. So this was actually delivered in the right way. Vice versa for Colombia, where we were basically in a big city. So in Tanzania, we were in a city in the middle of Tanzania, while in Colombia, we were in the capital. So this was also a little bit easier. We produced an information sheet, of course, in Spanish. And we delivered the information in this way. This information sheet was supposed not to be enough for Tanzania. That's why we opted for the video recording. Thank you. I think I reply to your question, but in case, feel free to ask again.
Thank you so much. Yeah, if you guys wouldn't mind, if I could grab your email addresses in some form in the chat, that would be great. I'd love to keep talking about this.
Sure.
Maybe one more question for Mo as well. There is Mahek that is talking a little bit through the current funding issues that we have in the space. And I think, Mo, it might speak very well to your experience using agripreneurship as well in the context of refugee settlements. Maybe you could even bring up the Kirandongo example that we experienced together. And how far could the psychological training really add to maybe answering Mahek's question? And maybe you can take it together with Lionel's question as well. That is asking whether if the agripreneurs come with a traumatic stress disorder, if you would have adjusted the training in that aspect. Yeah, over to you, Mo.
Julia, the first question is on what exactly?
In the aspect of the refugee context, talking a little bit through the example that we might want to bring up in Kirandongo. And I think
Yes.
the question is, given these circumstances, am I right to think that behavioral science may have limits in applicability here? That was a question from Mahek. And if you can also in your answer touch on Lionel's question in the chat, that would be great.
Thank you, Julia. I can't see the chat questions because of my connection, but I will try. Yes, the training differ depending on the context. So I shared only two examples or pilots, but there was another one in Mozambique, also done by the World Bank, where they targeted farmers who can't read or write. So the training was a bit different. We are also trying to help vulnerable people, like extreme poor or refugees, for example. This is something we're doing right now in Uganda, where we're trying to understand the capability, opportunities, and motivations for these refugees. And we had quite different personas in our scoping mission. We met some refugees who have been there for, let's say, 4 or 5 years, and you could see that they exhibit these behaviors that we associate with successful agripreneurs. One of them, for example, was producing juice from his own refugee tent. And it wasn't like a poor quality product. It was a proper packaged juice that you can see in any shop. So yeah, so it has to change depending on the context and the analysis and behaviors of our target agripreneurs. What was the other question?
Lionel, if you want to come forward and also ask the question yourself, if you're still with us.
Hi, yeah, I'm still here. Yeah, thanks so much for the presentation. I was just wondering, so maybe like in Mozambique, where there was a civil war, you know, individuals, farmers, agripreneurs have gone through post-traumatic stress inducing experiences. Is there an additional psychological component to the training that you have to do with these trainers, with these farmers, to get them to be more like to think more about self-efficacy and taking charge of your own life?
That is a great question. Thank you very much. So in the case of the refugees in Uganda, they were escaping war from Sudan. We haven't planned or we haven't done or tested psychological support, but while we were there, they had just finished a 30 days psychological support session that was done through volunteers, and you could see a huge impact in the life of the people we spoke to. They were a bit uncertain about things. They have lost everything. They don't know how long they're going to be in this refugee camp, and they were more settled. They exhibited different behavior. They tried to invest more in their lives now, in the refugee. Where they were hosted. I had a point in my mind, but I forgot it. Julia, you were there. Do you want to add anything?
Yeah, I think it was quite striking, right? You find, we were in the car with those people that were showing us the camp, and they were living there for quite some time. And we were asking them, like, what was the one thing that really stood out for you in terms of support? And we were driving by the WFP tents that was mentioned here in the chat as well, that are giving out food rations, etc. And they were saying that really the psychological support that they received was one of the most important interventions, and that is really important for us working in this context as well, to highlight that psychological interventions are not done enough yet for really being able to be scaled up, and that we have to invest more in it also as UN organization to take this on board more as our core programmatic areas. I think, Mo, what also stood out to me when we visited is, for example, in this innovation hub, they painted the ceilings blue, and they even said that they did that as a support mechanism to really foster positive feelings as well in the support center of being cushioned and feeling warm and feeling supported. And that's also where they've done the psychological support services. And that was connected to innovation or entrepreneurship in the settlement. Well, I don't know if that's what you had in mind too, but I found that, yeah, that still sticks to me after the mission.
Yes, the last point I want to mention is about resilience and how we have to make sure that we increase the resilience of these people. Doing innovative work, if you are vulnerable, is quite challenging because it requires a lot of experimentation. And we need to make sure that failure does not lead to loss of assets and reduction of resilience. But I think what we're trying to test now to see how does this self-efficacy and error mastery orientation affect this makeup of framework of resilience in general.
Great, thank you so much, Mo, and also Luna for coming forward and asking the questions. Unfortunately, this really informative, interesting conversation with those three experts have come to an end for today, but you can see the research in the chat. You can connect with them beyond the session, and thank you all for joining. And we will definitely share the recording in case you want to dive in deeper again in the presentations as well. And yeah, I hope you all still have a really inspiring UN 2.0 week, and also attend the other sessions by UNHCR and UNICEF later today. I'm really much looking forward to seeing you potentially in other forums again. And I will close with a massive thank you to the three speakers. This has been super insightful, great presentations. Thank you so much for joining us today. Thank you for taking the time of also sharing your knowledge with the innovation community here.
Thank you, Julia.
Thank you very
Bye-bye.
much.
Thank you.
Bye.